Doctors were not burnt out. They were demoralized. Chronic medical illness was everywhere. Morbid suffering of patients, hopelessness, lack of meaning and purpose, remorse, death, anxiety, disappointments, struggles over the state of being. So much death overwhelmed the doctors at the center core of the loss of over 330,000 patients. In one study during the pandemic, Dr. Eric Reinhardt, MD, PhD, stated they were not overworked nor burned out. Dr. Reinhardt stated he made it clear that they were demoralized by the healthcare system. Terminal ill healthcare systems where doctors feel helpless and their hands are tied because of a disease system in which they work. Bernie Sanders preached this policy for years. The United States does not provide single-payer universal health care. The profits out of the medical system, the insurance companies, and the pharmaceutical companies would not be able to dictate who lives or dies. The United States is a very profitable nation. It maintains its profit for medical, not for actually curing the patient, to only create more disease. Healthcare is so expensive, tens of thousands of patients' death could have been prevented. This occurs every year and has been going on for decades. America spends more on health care than any other nation, so why haven't the deaths in America decreased? There are still millions of people without health care. $105.6 billion in health care costs could have been saved, associated with hospitalization from disease, and another $438 billion could have been saved in a non-pandemic year. That's hard to believe. Healthcare reform is long overdue. America is senselessly losing lives and tons of money. People who do not have primary care doctors suffer from preventable diseases like type 2 diabetes. People wait longer to see a doctor. These two factors increases the mortality rate, and the disease is more likely to be spread. 28 million Americans before the pandemic have no insurance. 9 million more Americans lost their insurance due to unemployment. Even when Americans feel comfortable with workers' insurance, employees-based insurance can be cut off whenever it's deemed necessary. It doesn't matter who runs the numbers or how the numbers are run. Universal single-payer health care should be mandatory. It would take the power from doctors who are driving in the lane of personal profit and power for themselves. It would take the power and profit from the pharmaceutical and the insurance company. The oath that these doctors took wasn't worth the paper it was wrote on. Draconian ways of the medical institution didn't change their ways. They continued to put profit before the people. American ideology is dead. You are witnessing the treatment of poor versus rich health care. Poor patients was illegally saddled with death, which they were entitled without cause. Tax incentives was exploited, which was meant to promote care for poor communities to turn a large profit, understaffing the hospitals and undercutting patients' care, while hospitals sat on billions of dollars in cash reserves. This isn't new. It's just hard to ignore. Profit over the people once again. The fight for healthcare have continued and has been defended as business ventures. If healthcare systems become a public institution, doctors are now in a battle of healthcare rights, which are civil rights and human rights. Doctors lose their power, their elite status, and the unequal healthcare system designed for personal rather than public moral responsibilities for protecting health. Yes, doctors were told they would make less money. Well, who does the Hippocratic Oath really apply to? And who wrote it? Did the AMA write the Hippocratic Oath along with the FDA? How is it possible to trust a healthcare system when the AMA devises a political strategy, which is their billing code, that protects the profit of healthcare, not patient care? The American Medical Association controls and dictates every aspect of medical practice, shaping treatment choices and producing endless administration work. The FDA is in the bed with the AMA, and every executive that leaves their job from the AMA goes to the FDA. Politics and medicine have become bros. The lives of 1.1 million Americans were killed by the pandemic, which in many ways could have been preventable. The realization is doctors no longer believe the rhetoric they've been lied to for decades. This is not burnout. This is a pure slaughter, a massacre. The massive loss of lives in the healthcare system that is so powerful and profitable is for profit only. A system that manages disease and would never take responsibility for creating more disease by medication, x-rays, imaging, chemo, and radiation. The healthcare system calls it side effects and risks. No. More disease has been created, and many patients die from the side effects created by the medication and aggressive treatment and surgery. Side effects created by who? The medical institution will never say you died from any of their procedures. No, you died from diabetes and heart disease and chronic kidney disease. The health profession will never take responsible for the loss of the patient, but they are standing in line waiting to collect off the deceased. Insisting on change in healthcare reform is the answer. Our healthcare system must admit it is part of the problem and not the solution. Doctors need to join forces. The massive deaths caused by the pandemic rocked the medical community, and the world's mental health peeked out from around the corner, from every block, and snatched the minds of the healthcare workers and put them in a van. They became the stars of Homeland. The sadness of the medical institution cracked under pressure. Doctors, nurses, co-workers took their lives also. They began to leave their jobs by the droves, and the placebo no longer worked. The tables were turned, and all the terminal illness and palliative care the doctors has been exposed to. They realized they were the patients not suffering from depression, something much more than that. They now had taken on the identity of doctors demoralized by the healthcare system. Hopelessness and lack of meaning to the profession, which no sense of self made them terminally ill. Dr. Reinhardt is a political anthropologist, psychoanalyst, and physician at Northwestern University. I'd like to take this time to thank Dr. Reinhardt for stepping out on a limb, revealing our healthcare system. Now you understand why there are so many doctors on YouTube. If you like this video, please come back and subscribe. I have so much to share, and I really enjoyed this moment in time.